name is LHay, and I'm here to talk to you about the best care options for pregnant women with HIV in resource-limited settings. Project, knowing that I had a really strong interest in obstetrics, so that's kind of where I started when I was trying to figure out what I wanted to focus on. I came across an article about the prevention of mother-to-child transmission in HIV. Became immersed in this article. I was so fascinated by the connection between pregnancy and HIV. Little to nothing about HIV itself. A bit of preliminary research about the virus, my knowledge on it, and I actually found out that it's really relevant. It's a really relevant topic, and that it's really important. I found that 2 million people living in the United States today, and 1 in every 6 of those people are unaware of that infection. It blew me away because HIV is something that people know a little bit about, but nobody talks about. So I went back to obstetrics and started looking at HIV again. I found a lot of information about pregnancy prevention for women with HIV, but not a lot in support of women with HIV that wanted to have children. I wonder if pregnant women with HIV were getting the proper care that they needed, and if so, was this care available to women in resource-limited settings? Through my research, I found that 3 really important factors for pregnant women with HIV. The first is a strict adherence to antiretrovirals. Antiretroviral drugs are the drugs that suppress the amount of virus in your body, important for personal health for the patient, but also in preventing transmission of the virus. It's extremely vital when you're handling someone that's pregnant, because keeping a strict adherence to the medication, you can transmitting the virus to your child to less than 1%. The second factor is affordability and availability. Especially with a low resource setting, a low resource setting is when someone cannot provide for proper health care. That they know that they have health care that is affordable and available to them, which is all part of Medicare and the Affordable Care Act. And so it's just really important that people know that they have those options, care that they need, because if they know proper steps to get there. The third and most important, in my opinion, factor in a proper care program, support system that's filled with compassion and confidentiality. The confidentiality really comes into play with HIV because it's so personal and so private for the people. And like anybody can see, you have to have a strong support system because you can't do it on your own. So it's really important that they have people that they're working with, like their healthcare professionals, are compassionate and understanding and help them know that they are in a safe and supportive environment. To my research, I volunteered at the Walk-in 5K to End HIV on November 12th in Washington, D.C. by Whitman Walker Health in order to raise support and money for the fight against HIV. I volunteered by helping to set up the event in the morning, and then I worked in the registration tent throughout the day. So we registered and signed in the 3,200 plus participants at the event, and the event was really successful. They raised $70,000 in donations that was going to go to help serve HIV patients. So this picture here, my friend Alex went with me actually to the walk, which is great because I have someone to share with. Picture of one of the charts that they had up, and they had a little basket of Sharpies so that people could sign their name and write encouraging messages, create a sense of unity. This is a picture of me standing in front of one of the 3 memory quilts that was at the event. The memory quilts were made in remembrance for loved ones that have passed from HIV or that had a really strong impact in the community or in the fight against HIV. Really humbling experience for me. I wanted to go to see impacted people's lives because I'm not someone who's impacted. So it was really great to see the people who were so moved by these quilts, and it was a really emotional experience for them to see how important it was. If I observed at the HIV clinic at the UVA hospital in Charlottesville during the month of December, the West Complex where the clinic is, I couldn't take a lot of pictures inside for confidentiality under the nurse practitioner in the clinic, Yvonne Newberry, her RN, Lauren Stevens, case managers, Liz Reeder. These women were awesome. They were so much fun. I got to learn viral medications and healthcare policies and prevention medicine, sit in on some of the patient appointments with their pregnant patients, which was totally unqualified to be in the room, but it was really awesome. This HIV center is actually kind of the hub for HIV patients in Central Virginia. They serve 80 patients, 80% of whom can only afford care because of the Affordable Care Act and because of ADAP, which helps cover the cost of medication. So I really learned that at the heart of any good care program is a professional that cares about each and every one of their patients and making their life better, and that's what I saw in this clinic. It's so important to have a strong personal relationship with the people in the clinic because that helps to ensure that patients want to come in and feel safe and feel comfortable coming to get their treatment supported. These are the clinics that are really great. For my community service, I volunteered with the Paul Stephan Foundation here in Orange under the supervision of the Executive Director, Evelyn James. Paul Stephan Home is a home for unwed mothers here in Orange County, and so they work to provide a safe and supportive environment who don't have that, and so that they can be there through their pregnancy or through the early years of their child's life so that they have support. So through the foundation, I volunteered, and I helped with childcare. So I would watch the women's children because a lot of them were taking online classes or full-time job and watched a child on their own full-time, and that's a lot for any one person. So I helped to give them a little bit of time so that they could catch up on work or do whatever they needed to do. And so this picture of Evelyn was actually taken by this sweet little girl, Leilani, who was one of the girls that I worked with, who I also worked with really closely. And I found through my community service that we're so changed by this home. I couldn't imagine what their lives would have looked like if they didn't have an environment where they knew that they could pursue an education or pursue a career and not be on their own in that. So I knew that through my legacy, I really wanted to do something to continue to help people because I knew I wasn't going to be able to do that next year after I leave for college. The National Honor Society at the school, I worked a lot with Ms. Angadi, one of the advisors for National Honor Society, and we met with Evelyn and others for privacy. But so we met 2 days that we have yet to determine NHS kids to go to the homes. It's 2 homes in Unionville and 1 central location in Orange. Paint and weed and do minor repairs at the homes, and that one of the BRBGS seniors from last year actually put in at the home, improve the atmosphere. But the biggest part of my legacy for me, the most important part to me, is that I'm starting a babysitting program through the National Honor Society where students can sign up babysitters basically next year, where they will be recognizable and trustworthy to the mothers and go once or twice a week to the main location in Orange to babysit and give the moms a chance to study, just kind of like I did, just a continuation, because it really goes a long way. It was so amazing. It changed my life so greatly. I got to study a topic that was really, really awesome. I did love the virology of HIV. I didn't get too much into it. So cool. And I got to see personal connection is and how big of a difference that makes. It validated my decision to study medicine in college for the next few years at one of these. I'm working on it. And the best advice that I can give to uprising seniors is to get started early. I was people that had their internships done over the summer. Your project is reliant on the people that you work with, your supervisors, your mentors. So I'm waiting to hear back from them. And with deadlines approaching, that can kill you. And it's so stressful, and you don't need your year when you're figuring out stuff about college. So if you have it done early, no stress. And lastly, I'd like to say thank you to to my advisors, Ms. Herndon and Ms. Carlton, for all of your counsel. It really helped me to have through this project. It's really impacted my life, so thank you.
I think it's great that you were able to work with the babies. And I guess my question was, you said that you didn't really have experience or knowledge about people struggling with HIV and getting around that. Like it helped you have this experiential, I don't want to say vicarious, but you were able to like empathy or do sympathy for people. Things. I know that work you deal with a lot of kids, especially in Africa. You deal with a lot of kids that have HIV, and it's like people are even afraid to touch them, so they get that care and that nurturing they need and deserve. And so my hope for you, it's not a question so much. My hope for you is that this experience that you said kind of changed your life. Is that it will not just be short-lived for this project. That as you go forward, that you'll have people out there, especially a lot of kids that are adopted, that are going through these experiences. My hope for you is that that will be like a long-lasting impact to be able to do that, because there's a lot of kids that get neglected out there.
Yeah.
So I think it's really cool.
Your legacy is great. I like the idea that from the school to go there, because it, as a mom, it is really stressful to have somebody else watching your child.
Yeah.
So if you can get, you really rely on to go out there, and the moms can feel safe to leave their child with your kid. That's a great legacy. That's all. Yeah.
Thank you. And there's so much stigma about these women alone having children, about whether or not they can support them. And in an HIV setting, there's so much stigma about whether or not it's moral for people with HIV to have children. So I realize it's just that it's so important that they can trust the people that they're working with, and that they know that the people are there to support them.
Actually go to HIV, sit in with some of the doctors and get any advice that you've heard that kind of surprised you. I know you have those three things that you said were most important for caring for each other, but thought was something you never have expected.
I don't know about advice so much, but I learned really how hands-on they were with each of their patients. Especially when it comes to, like, a lot of the patients, like I said, are in low resource settings. And so, because they work with care, they might not have the means necessarily to get there. They have patients that live away from the clinic that come once a month or however often they have to come to their appointments. And these women work so hard to make sure that their patients get there. They will people up to